This medical camp play a very important role in bringing health services closer to the people, while also raising awareness about prevention, early diagnosis, and treatment. In Nairobi County, and particularly this Roysambu sub-county, the demand for healthcare services continue to increase as the population grows and urbanization expands. This growth represents both opportunities and challenges for our health systems. On one hand, we have improved infrastructure, access to skilled professionals, and expanding medical technology. On the other hand, we must continuously strengthen our health systems to ensure that services remain accessible, affordable, responsive to the needs of the population. Community-based health initiatives, such as the one we are witnessing here in example of a medical camp, are extremely valuable because they bridge the gap between healthcare providers and community. Many people do not regularly visit health facilities unless they are unwell. Medical camps, therefore, create an opportunity for individuals to access health services such as screening, consultation, health education in a more accessible and welcoming environment. So for today, one of the focus today in the discussions here that is going to be here is the burden of debilitating diseases affecting our communities, specifically in Roysambu sub-county. Across Kenya, we are witnessing a significant rise in non-communicable diseases such as hypertension, diabetes, cardiovascular diseases, and cancer. These conditions are increasingly becoming major causes of illnesses and death in both urban and rural settings. Hypertension, for example, is often referred to as a silent killer because many people live with it for years without realizing they have it. If not detected and managed early, it can lead to serious complications such as stroke and heart disease and kidney failure. The other discussion that we are going to have here is going to be about wellness and preventive health. Health is not simply about treating illnesses once it occurs. True health involves maintaining physical, mental, emotional, and social well-being. Preventive care is therefore one of the most powerful tools we have in improving health of our communities. Many of the diseases affecting people today can be prevented or controlled through lifestyle choices and healthy behaviors. The other discussion point that we are going to have here is the professionals are going to tell us about the medical interventions and the pathways through which patients access treatment and care within our health system. As healthcare providers and public health leaders, our goal is to ensure that every resident within Roysambu sub-county and Nairobi County has access to quality healthcare services when they need it. This requires continuous investments in healthcare infrastructure, trained personnel, diagnostic services, and effective referrals. Ladies and gentlemen, I, as the sub-county MOH for Roysambu sub-county, we are particularly interested in primary healthcare because we are the custodians of primary healthcare in the sub-county. And when we are tasked about delivering quality health services in Roysambu sub-county and in any other sub-county, so we are the ones who are answerable for primary healthcare. As you all know, the President of Kenya signed an Act of Primary Healthcare Act 2023, in which in it is universal healthcare coverage, where quality healthcare has to be accessible and closer to the community. A key aspect of primary healthcare, ladies and gentlemen, is preventive and promotive health. So when you deal with preventive promotive health, and if you look at it, it's actually a genius idea because the shift is now moving from curative health to preventive health. Because once you deal with the preventive health, then the cost of curing those ailments becomes low. The burden of treatment becomes low. The morbidity becomes low. So that is why the president and the technical personnel who are advising and coming up with the act and policies have actually done a good job. And this is seen. So everything is connected. For you to ensure that the primary healthcare is working, then health has to be accessible, not so? So you have to strengthen the part of health insurance as well. And that is why the government is trying to sort out the issue of SHA, ensuring that the cost of treatment is low. So the access to treatment is actually seen by everyone. So ladies and gentlemen, today's discussion, I want us to be open-minded. There are so many experts who are here. We ask a lot of questions, we interact, and we get to know what we don't know. We remove all those misinformations and all those other things that we don't know about ailments, anything. Me, you can ask me anything to do with primary health care. You can ask me anything to do with SHA. I might have answers there. The other experts here are going to talk about specifically about illness, diseases that are there, the debilitating diseases, hypertension, diabetes, cancer, stroke, name them, okay? So I would like us to engage, ask questions, and we are going to benefit, hopefully. Thank you very much. Back to the MC.
Thank you so much. And I agree with you 100%. We have to look at the preventive way. If we are able to prevent some of the diseases, it goes a long way. And you know, the entry level to prevention is awareness. What you are doing today, getting empowered, right? So I'm really delighted to have a panel of distinguished medical professionals who will share their expertise on some of the most important aspects of cancer awareness and management. Cancer remains one of the leading health challenges, but early detection and prevention significantly improve outcomes. So in today's discussion, we're going to focus on practical knowledge from screening guidelines to treatment approaches and how we are able to empower communities with information that saves life. And as a mental health practitioner, I am also deeply aware that cancer is not only a physical journey, but an emotional and psychological one. Even from my engagement, when I'm going through sessions with patients who have been maybe diagnosed with cancer, one of the things that stands out is they feel their life has stopped. They are going through emotional and mental distress. So we are looking at health holistically, right? And I look forward to having a rich and insightful conversation with our panelists. And I would want to just highlight who they are. And once I mention your name and even include your bio, because we have people who will give us a lot of insights, right? Are we ready to learn? Are we ready to learn? Are we ready to ask questions? That's really good. So I will start with Dr. Mutuma. Dr. Mutuma is a renowned Kenyan clinical and forensic pathologist who played a key role in establishing the Kenya Cancer Registry. He has extensive experience in pathology, having worked with the Kenya Medical Research Institute, KEMRI, and as a consultant. Key details about Dr. Mutuma is he specializes in clinical and forensic pathology with a focus on oncology and infectious diseases in East Africa. He holds qualifications from master's level in pathology, diploma in forensic medicine, among others, and his contributions include he is credited with initiating the National Cancer Registry in Kenya. He has published works including studies on familial clustering of cancer and ventral, this word I can't mention, leishmaniasis. You'll tell us what that is. And previously affiliated with KEMRI and University of Nairobi. I would want us with a round of applause to invite the one and only Dr. Mutuma. Karibu sana daktari, you may have a seat. Karibu sana. Then our second panel is Dr. Victor Wanjohi Kariuki. Is a dedicated medical professional specializing with obstetrics and gynecology, practicing in Nairobi, Kenya with qualifications including masters in obs and gyna, Nairobi, In 2008, Dr. Victor Wanjohi is committed to providing comprehensive obstetric and gynecology to women in the region. His practice is located in Nairobi, and his focus is on delivering personalized and effective care to meet the unique needs of each patient. He is dedicated to ensuring the health and well-being of women through all stages of life, from pregnancy and delivery to menopause and beyond, is well taken care of. Help me invite Dr. Victor Wanjohi. A round of applause. A round of applause. I'm looking around. Can you see that I'm looking around? Okay. Then we're going to have Dr. Anthony Ndiritu. He's a clinical and radiation oncologist at the Kenyatta National Hospital. He's also an admitting consultant at the Nairobi Hospital, MP Shah, Nairobi West Hospital, and many more. He holds a bachelor degree in medicine and surgery from Moi University, a master's degree in clinical radiation oncology from the University of Witwatersrand, South Africa. He's a fellow of the College of Radiation Oncology. He holds a certificate in nuclear medicine from Cairo University, among others. A round of applause for Dr. Anthony Ndiritu. Karibu sana. So what I will ask us, if you have a question, I will ask you to jot it down as we continue with this conversation, and we'll have a time whereby we'll get to hear your question so that the doctors can get to respond to your question. Is that okay? Thank you very much. Okay. Thank you very much for coming on board. And I have a quick question to Dr. Mutuma. Could you explain in simple terms, the role of pathology in cancer diagnosis and why accurate staging and grading matter? Explain to us in simpler terms so that everyone can be able to understand. Thank you, and over.
Thank you very much for that. Good morning, everybody. Good morning. Right, my name is Dr. Geoffrey Mutuma, the way he has said, and thank you for introduction. Don't bother about the names you cannot pronounce. Yes. Even myself can't pronounce them, so relax. Right, so I think I'll talk about pathology mainly, and what it is that we do as a pathologist is that the major work we do as pathologists is to make a diagnosis. And mainly, when we talk about diagnosis, mainly in pathology and more in cancer, is that we normally know which type of cancer it is in the microscope. Most of the times, or all the times, before you are told that you've got cancer, is actually the pathologist who looks at that tissue, at that growth, and that he says this is cancer under the microscope. I know most of us, we know the word cancer, and using the best example, cancer of the breast. When somebody or the doctor tells you you've got cancer of the breast, that is a general name. Because in pathology, there are so many types of cancers, And that's why, like cancer of the breast, which is the commonest cancer in women in Kenya, and would be the commonest cancer in women in Kenya in future, is that there are many cancers of the breast, and every cancer of the breast has got its own treatment. It means that when you've got cancer of the breast, for the pathologist, he must inform the oncologist which cancer it is, so that he knows how he can be able to deal with that cancer, because all cancers are different, and the treatment of most of the cancers is very different. Even cancers of the prostate, of course, we know the commonest, but we have got different cancers in every organ. It means that cancers are different. Is the pathologist who knows which cancer it is. Now, the staging. Staging is very easy, and of course, most of us in pathology, we do the stages when we are looking at the cancer. Most of the times we do the staging when the whole cancer has been removed from the body, and staging of cancers is just the size of the cancer, nothing much. And the size is just the centimeters. And that's why staging of cancer can be done by the pathologist. That's first thing. Second thing, the cancer can be done by the surgeon when it's operating, or can be done using X-rays, mainly the CT scan, because the CT scan can check the size of the cancer, and also MRI can check the size of the cancer. So as pathologists, what we do is that when the cancer is removed, I'll use the cancer of the breast because it's the easiest to stage. Cancer of the breast, the stage is in centimeters and is very simple. We just go by centimeters. If it's 1 centimeter, that's a size of a maize seed, that's 1 centimeter, that's stage 1. And that's why when cancers are stage 1, it is difficult to get them as a patient because the cancer is too small. When it's 2 centimeters, that is stage 2. 2 centimeters, that's stage 2. When it's stage 3, it's 3 centimeters. So we just go by the size, the diameter of that cancer. It's so simple, straightforward thing. And when it's stage 4 now, is when it's more than 5 centimeters in diameter. There is the size of a potato, or the size of a tomato. The cancer is that size. So when cancer is that size, that's when stage 4. But what is very important when cancer is in stage 4, it's what else that cancer has done to the body. Because as we know in Kenya is that 83%, even it's more than that, of the patients who are seeking for treatment of cancer today, they are in stage 4. 83%. It means that high percentage of patients in Kenya, they are coming to the hospital when their cancer is the size of a potato or tomato. That size, that's 5 centimeters, and that cancer is normally very big because these are group of abnormal cells which have grown to that size. Now, when the group of cells have grown to that size, most of the times they have moved from the original primary site to other sides of the body, which is called metastasis, or the cancer has moved from where it is to other parts of the body. And that's why most of the times, when it comes to management, and I think Dr. will be able to mention on that, on management, because as pathology, we have no issues of management. We just tell you that we have a cancer, the rest of it, we leave it to oncologists or the surgeon to deal with that. Now, when it comes to management, when cancer is stage 1, it's very easy to be removed completely, and you are cured. When it's stage 4, the game changes because it has moved from where it is. If is cancer of the liver, and that size is very big, that size, it means that even if you remove the liver or you remove the cancer, even if you remove the cancer, the treatment is not complete because the cancer has moved from where it started growing to other parts of the body. Most of the cancers, especially cancer of the breast, they have a tendency moving to the lungs because breast and lung are very near, and then also it has a tendency of moving to the bones. So when you've got cancer in the breast and it's stage 4 now, it means that you'll not be, even if you remove the breast, even remove the whole of the breast, it means that cancer has already left the breast and moved all over the body, what we call metastasis or spread of cancer. So that treatment is very different. That's why staging is very important. Both, either you are staging as pathologist, or you are staging as a radiologist, or you are staging as a surgeon. That's why staging is very important in cancer, and that's we cannot start the treatment most of the cancers unless and until we have done the staging, because it guides the doctors which method to use for that treatment. Thank you.
Wow, a round of applause for that. Wow, thank you. And maybe a follow-up question, yeah? You say people come in when it's already, the cancer has already grown, yeah? So what are some of the challenges that make individuals come in when it's either even at stage 4? That's when they are realizing the urgency of seeking medical practitioner.
Right, that's a good question. And the fact is, one, is that cancer is not painful. Cancer is a part of the body. Cancer is abnormal growth of the body. It means that cancer is a part of your body. So whenever it's growing and very small, you don't feel it because it has no pain. And that's why there's a big difference between cancers, such that most of the cancers, in fact, all cancers, there's no pain. People feel that, and these are found it very common in patients. When you tell a patient that you have got cancer and he has no pain, the patient does not accept. Especially, I've seen this, especially for cancer of the breast, which I keep on referring very much, especially young girls who are 20 years, 25 years. Telling somebody that age, because remember, people think cancer is related with the age, they cannot accept. And when you are young and you have got cancer, they tend to spread and move. They are very aggressive when you are young. So most of the times, most patients, they come late, not because of their mistake. Is that how the cancer is? And it does not matter who you are. Everybody, even as the doctors, when you've got cancer, you cannot know until and unless you have done screening. And that's why we always emphasize on people doing the screening for the cancer. It is important to do the screening for the cancer. There are so many ways of screening. I'll come to that later. But that's why, unless you have done screening, you cannot know when you've got cancer stage 1. Cancer of the breast, cancer of the cervix, cancer of the liver, cancer of the prostate. And that's why when people have got cancer stage 1, cancer stage 2, and some stage 3s, they cannot know. Now, when cancer is stage 4, is very big. So if you have at the breast, you find your breast is very big. And then you start noticing there's something wrong. Because when stage 1 is very small, you cannot even know if you've got cancer. And then what brings the patient is signs and symptoms of cancer. When you've got signs and symptoms of cancer, that's straightforward stage 4. Because when you're stage 1, stage 2, and most of stage 3 is no signs and symptoms. And that's why you find that patients coming to hospital stage 4, that's not their problem. In fact, that is how cancer is, because it has no signs, cancer is not painful. And that's why most of the times when you tell somebody I've got cancer, you tell somebody has got cancer, especially when you screen that person and you tell him that you have got cancer, most people don't accept, because they expect cancer to be painful. And because it's not painful, they don't accept they have got cancer until when they cannot breathe, or they have got they have blood, or they have lost weight. When cancer is stage 4, is when you start losing weight. It's when you have no blood, because the cancer has taken your food, your glucose, and is growing from your food. So you don't, the rest of the body does not have enough food, so you lose weight. And also at the same time, the cancer has already started sucking your blood. So you have no blood, is when you know there's something wrong with me. Now, when you've got signs and symptoms, it means that that cancer is already stage 4. And that's why today, people go to hospital, almost 90% of the patients, they go to hospital today when they're stage 4. And that's not the issue of the patient per se. The patient, we don't say that has not neglected herself or himself because he was or she was feeling well. She goes when she has got signs and symptoms. And remember, it's those who are sick who go to see the doctor. So when we are not sick, why go to see a doctor? But nowadays, with cancer and other non-communicable diseases, it's always very important to go for screening, to go for routine screening for the cancers, because screening saves life. Treatment, it is good, but it's only screening which saves life. The more we know about cancer, the more lives we save. The more we diagnose cancer at stage 4, yes, we save life. And before I finish, because I want to finish now, is that cancer is treatable and curable irrespective of the stage. Most of the patients, when they are told they are stage 4, when they are told they are stage 4, when you have got cancer, you come 3 or 4 of you, and I've seen this several times. And then you tell them you've got cancer, you discuss with them, and then they go out, and then they leave the patient outside, and they come to you as a doctor. Doctor, tell me, will this patient survive? Is it worth it keeping? It's very sad. Is this worth it putting our money? Will this patient survive? But the fact is one, especially at this time, cancer is treatable and curable irrespective of stage. It is better when you get it stage 1. it's better when you get stage 2. But irrespective of the stage which the cancer is, can be treated and you can be cured and you stay cancer free. So whatever stage it is, you don't need to worry. Whatever you diagnose it is, of course, there are several cancers, which 2 or 3 cancers which are tough to treat. But most of the cancers, the cancer of the prostate, treatment is almost, cure is almost 90%. Almost 90% cure rate cancer of the prostate. Breast depends on the stages and many other things. So whatever stage it is, don't worry. Treatment is there. What is very important for patients with cancer is to follow what the doctor is telling you. Most people, they come for 5 cycles and they do laboratory on that, and they go. They think I'll be treated. Or you are operated, and instead of going for chemotherapy or radiotherapy, you go. And that's why we lose most of the patients, and because of not completing the cycles of treatment for cancer. Thank you.
Wow, a round of applause. So I've been informed. So I deeply apologize for not calling in Dr. George Obonyo from Texas Cancer Center. Kindly join us in the panel. Dr. George Obonyo. Sincerely sorry. A round of applause for Dr. George. He's an oncologist and palliative care officer from Texas Cancer Center. And all branded. That's very good. Karibu sana. Wow. So thank you so much for that. And what Dr. is saying, there is hope, right? Regardless of which stage the cancer is, there is hope. Be it stage 1 or stage 4, right? Yeah. So I would want to quickly go to Dr. Ndiritu. What are the latest advancements in radiation and targeted therapies?
Okay, good afternoon. It's good afternoon. Okay, she has asked a simple but a very huge question. So I don't know where to begin that, but actually what I need maybe is to give an overview of what cancer treatment is, so that we understand where each of these things fall. From the introduction, she said I'm a clinical radiation oncologist. Clinical radiation oncology is a field of oncology or cancer management that entails the scope comes all the way from screening, diagnosis, and treatment of cancer. But when you come to treating cancer, they are classified in different categories. There is, of course, the pediatric cancers, which are for cancers for children. But when you come to the other aspects, there is what we call medical oncology, where they treat using medicines, chemotherapy, targeted treatment, and all that. Then you have the clinical oncologists who do both chemotherapy, the targeted therapies, and also the radiotherapy. And then you have other fields like hematology, the ones who treat blood cancers. So the question she asked has touched on 2 different aspects of treatment. But the way I would want to approach it is from the part of screening. You have been screened, you have been found to have something, let's say, in any part, and I'll not just say the breast. It is the most common, but since I can see we also have many in the group. Let's use now the example of prostate cancer. You've been found to have prostate cancer. So the first thing is to make the diagnosis. Then once you make diagnosis, then you do the staging, which Dr. Mutuma has talked about. The staging, you're trying to find out how big is this cancer? How far has it gone? Has it spread to other organs? Because that informs about how you treat this cancer. So the staging is very important for the person treating the cancer, because it dictates what treatment modalities you are going to use. And that is the whole spectrum of all the cancers. Then once you have done your staging, now you sit down and in what we call a multidisciplinary team, which will comprise the pathologist, the radiologist, the oncologist, medical oncologist, radiation oncologist, the surgeon, so that you agree what is the best treatment for this patient and what comes before what. In terms of treating cancer, the first thing is if it's a cancer that requires surgery, then you will go for surgery first, if it is surgery that is required first. But the main treatments of cancer, there is surgery, there is chemotherapy, there is radiotherapy, and then there are other specialized or advanced medications, which are where the targeted treatments are. So it is like a branch of chemotherapy that is used to treat cancers. But there are newer drugs or newer molecules that they are called targeted because we look at at different aspects of the cell, the cancer cell, and see, is it expressing some things that we can target with the drug, so that the drug is very specific for that cancer. That's why we call it targeted. So when we come to surgery, the aim of surgery is to remove the cancer, and if possible, you remove the whole of the cancer, and that would be the perfect scenario for you to have better chances of curing this cancer. Sometimes you may not be able to remove the whole cancer. Or sometimes you have removed the whole cancer, but there is some microscopic disease that you can't see on the scans that may be left behind. and that is what necessitates other forms of treatment. We call it adjuvant treatment or additional treatment, and that is where chemotherapy comes in. Chemotherapy is medicines. They can be either injectable, you put through the vein, or you inject in other ways, or they can be even tablets. And they are taken at different intervals depending on which cancer you are treating. When you talk of chemotherapy, you're talking of, it is not one drug. It's like the way you talk of a painkiller. When you talk of painkillers, you could be talking of Panadol, Brufen, or there are many. So even when you talk of chemotherapy, you're not talking of one drug. It is many drugs in different classes, and they work in different ways. And every cancer has its own regimen of chemotherapy. So the work of the chemotherapy is to kill these cancer cells. There are cancers that don't, there are stages of cancer, let's say the cancer of the cervix. Certain stages we don't operate. We do radiotherapy with chemotherapy together. So all these modalities that I've talked about, some may have one or two, others may have all three, others may have one of them. So once you have done surgery and you have removed the tumor, then remember I said there is a team that will sit and discuss the best treatment so that you know, after surgery, I'm going for this. Let's use the example of breast cancer. You look at the tumor is not very big, then after discussion, you find this one, we can remove it up front. So go for surgery first. But then you need additional treatment, which is chemotherapy. Then you get the chemotherapy. The third stage is to get radiotherapy, depending on what we call risk factors. There may be a very small tumor that has been removed totally, and you may not require chemotherapy. You may have that, then when the pathologist looks at the types of cells and the characteristics that they're expressing, you're told you need to also take hormonal therapy. Hormonal therapy may be tablets that you take for maybe 5 or 10 years, still to suppress or to reduce the chances of your cancer coming back. The other treatment that I've talked about is the radiotherapy. Radiotherapy, from the word, it means you're using radiation. Just like X-rays, let's call them X-rays. You're using X-rays, but they are stronger X-rays, not like the ones we used to take, the X-rays that we used to diagnose. So we use a higher energy radiation, and our aim is to destroy the cell. You know, the cell, for those who did biology or science, you know, the cell has what we call the nucleus, which has the DNA and all that. So the radiation goes for that DNA and destroys the DNA, and the cell is unable to survive the cancer cell, so it dies off and it is not able to multiply. So that's how radiation works. So there is the way every cancer has, there is the way we structure the treatment for, depending on what we are treating. So that is the phase of radiotherapy. Then you may be determined not to get other treatments, like what you have talked about, targeted therapy. Targeted therapy, they are those treatments, they are newer molecules that are more targeted in that the pathologist has helped us to see that this cell is having this kind of targets that we can target, so that when the drug enters the cell, it goes for that particular molecule and it will attach itself there and kill the cell. So that's why it's called targeted, and it helps you avoid a lot of side effects, and it helps your treatment outcomes to be better. In terms of, because the question also touched on advances, in terms of radiotherapy also, we have advanced very much in terms of the techniques we use. When I joined oncology many years ago, more than 20 years ago, it is only Kenyatta which used to have a radiotherapy machine, and it was the older technology which could not treat some specific tumors to the dose that we want to give. But with the time, even with the government hospitals, we have advanced in terms of the technology that we are employing, in that we are able to also target that radiotherapy, so that you can have even very small tumors in the brain being treated with minimal side effects because of the advancements of the technology and the equipment that we use. We have very advanced techniques that are available in the country, such that even some of those techniques that you hear people want to do a fundraiser and go to India to get treatment, some of these treatments, we already have them here. It is just that you need to talk to your oncologist to be told what is it that is available and what is not available. Of course, there was a question you had asked Dr. Mutuma about why patients come late. Apart from the cancer symptoms not being so bad, like you may not have pain and all that, there are also other barriers that we see. Sometimes patients don't have money. These things they are expensive. You'll find a lot of radiotherapy services will be found maybe around Nairobi or the major centers like Mombasa and Nakuru. Not everybody is able to access that, and it's not a one-day treatment. These medicines I've talked about, they're also quite expensive. So sometimes you may have that as a barrier to get accessing these treatments. The patients have to travel to maybe to Nairobi. There are all those transport costs. They need to be in Nairobi for like 2 months accommodation. All these are barriers that make patients not to be able to access treatments. But to summarize is that, like Dr. Mutuma said, we have cancer treatment that is effective. Cancer is very curable, and people should not fear to go for screening. Because if you don't go for screening and the cancer is there, they will not go away. But if you go for screening, it will be detected that it is treatable. It is treatable. Majority of cancers are curable. Some cancers may be more aggressive than others, but some cancers can be even advanced stages. Like he gave an example of cancer of the prostate. You may have cancer of the prostate in stage 4, and you can be treated.